This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us this July 4th weekend. And today we're going to be talking about stroke treatment, and stroke awareness. We're delighted we've got with us Dr. Boggaram, who is the medical director of the stroke program at Medical City North Hills. Welcome to the show.
Thank you.
You know, I know it's so important to think in terms of signs and symptoms related to stroke. Can you refresh for our listeners what are some of the key red flags that you may be having a stroke?
American Stroke Association has put out an acronym long time ago that is called FAST, F-A-S-T. Anyone, layperson can recognize these symptoms. It stands for face drooping, arm weakness, speech problems, and that's the time to pick up the phone and call 911. But these are not the only symptoms. People can have sudden onset of numbness or involving face, arm, or leg. It can be on one side or both sides. Or you can see somebody acutely becoming confused, have trouble speaking, or even understanding. They can develop acute headaches, which is not explainable, or trouble walking, or having balance and coordination problems. It can be similar in both men and women. However, women tend to have some nonspecific symptoms also, such as unusual fatigue, confusion, disorientation. Sometimes these symptoms they tend to ignore and not seek help on time. To be precise, face fast is the one which everybody should know. And these are the symptoms that one should prompt to call the first responders ASAP.
You know, when you mentioned in your answer time, for our listeners to really comprehend this, why is time and immediate response to these symptoms so important?
On an average, 1.9 million brain cells can die every minute that the stroke goes untreated. Calling the first responders on time, a treatment can be started. Most often, these strokes are devastating. It is an emergency, and it's the number one cause of disability in the United States and number 5 cause of death in our country. And in women, it's the number 3 cause of death. And most strokes can be treated early on, but if you wait around and time is lost, brain cells die.
So are there different categories of strokes or all kind of the same?
No, there are typically 2 main types of strokes, ischemic strokes, and the second common type of stroke is the hemorrhagic stroke. Ischemic strokes are far more, they comprise about 87% of all strokes. Either the blood vessel is blocked by a clot, which is formed within the blood vessel, or the clots can travel from elsewhere, most notably from heart. Everybody has heard about irregular heart rhythm or atrial fibrillation on all the media outlets, and this is very important because the clots can form within the heart and then cause strokes. Typically in ischemic strokes, the blood vessel is blocked by a clot. In hemorrhagic strokes, there is bleeding into the brain matter or outside the brain. There is a small percentage of strokes which are cryptogenic, or we don't know the cause when it occurs. But looking in deeper and deeper, most of these strokes tend to be secondary to atrial fibrillation. There are few other categories. With the pandemic. We have seen COVID infection can increase someone's clotting risk and causes strokes. There are some unusual causes of strokes also. They are very, very small percentage. There can be inflammation of blood vessels called vasculitis, or someone has abnormal blood vessels. It's called fibromuscular dysplasia. And some people have unusual blood proteins which make a clot easily, and they have clotting disorders. And I'm sure our listeners have heard about sickle cell anemia, sickle cell disorders. These patients also are at a risk for having increased risk of strokes. Women who are on birth control, they are also at risk for having what we call venous sinus thrombosis, where the clots form within the brain or elsewhere. And some people have hole in the heart called PFO, or patent foramen ovale, and the clots can traverse through the heart and causes strokes.
You mentioned some really interesting things there about why you may have a stroke. What would you say some of the most common risk factors are to have a stroke?
There are risk factors which are under our control. There are some risk factors which are not under our control. Things that can be modified are high blood pressure, diabetes, high cholesterol, smoking, diet, which is high in cholesterol, trans fats, and other things, and people who are obese, people who have vascular problems such as diseases of the carotid artery, peripheral artery disease, and people who have atrial fibrillation and sickle cell anemia that I mentioned. They are all the risk factors that we can take control of and reduce our risk for strokes. Things that we cannot control are age. As one gets older, risk goes up. And people who have family history of multiple members having strokes, especially in younger age group. So there are some genetic causes that you cannot control. African Americans have a slightly higher risk of strokes in general, and women, when they get older, have slight higher risk. And people who have had heart attacks, previous strokes, also have a higher risk. And like I mentioned early on, there are some clotting problems. There are some genetic mutations that can cause clotting. These are the things that we have no control over.
This has been Dr. Bhagya Boggaram, Medical Director of the Stroke Program at Medical City North Hills. Next on our special Independence Weekend program, we're going to be talking with Dr. Donna Casey, who has some helpful tips on how we can take better care of our aging parents, grandparents, and loved ones. Next on the human side of healthcare.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back to the show. We're now going to focus on the elderly, our loved ones, and the caregivers that care for our older adults. And we're delighted that we've got with us Dr. Donna Casey. She's an internist at Texas Health Presbyterian Hospital in Dallas, and she's going to help guide us through these discussions. Dr. Casey, welcome to the show.
Thank you.
Dr. Casey, we all know about the baby boomer bulge. By 2040, 80 million adults over 65. How many in Texas?
To put this into perspective, the U.S. population is currently 330 million people, and the current over 65 population is 55 million. This over 65 population is growing rapidly due to better healthcare, technology, and standards of living. A quarter of this population lives in 3 states: California, Florida, and Texas. Interestingly, Florida has one of the highest over 65 percentages of the population at 21%, and Texas has one of the lowest percentages of population at 13%. And the reason this is important is older populations are going to require more state and federal resources. And I think this will be a challenge for some states in the future.
You're absolutely right, and likely here in Texas as well. And our legislature will be discussing that next year. You know, based on my experience in healthcare, falls or tripping are an issue with the elderly. Do you see more falls with men or women?
We see more falls among women than men. And it's important to note women have more fragile bones than men have. But obviously, bad balance, people fall a lot over their house shoes. People fall over their little rugs in their homes, next to their bed. They keep their feet warm. People fall over pets. We see a lot of falling in the middle of the night and for early in the morning when people are going to the bathroom. We see falling from dehydration because people stand up and feel dizzy, and falling from people that just are not exercising. They're not, they don't have good balance and good fitness. Your legs and your muscles, your quadriceps really stabilize your whole body and help your balance. And exercise keeps those nice and toned and prevents falling.
That was a great comment on exercise. We've done a lot of radio shows, and every physician emphasizes the importance of activity and exercise. During COVID, many people developed what we refer to as long COVID, and that involves fatigue. How does chronic fatigue syndrome, and especially people that had long COVID, impact elderly people?
The U.S. has a growing population even before COVID of chronic fatigue syndrome. We know chronic fatigue syndrome tends to address women more than men. There are a myriad of causes. Obviously, most recent, long COVID, right? We know that 10 to 15% of people that actually have COVID infection end up with long COVID, chronic fatigue, brain fog, body aches, just feeling bad. And because this is so new, we do not know how long this will last. I might mention that UT Southwestern does have a chronic fatigue long COVID program right now for anybody listening. Other causes of chronic fatigue, chronic pain, chronic depression, and any major chronic medical issue taxing your body that's wearing you down makes you feel chronically fatigued. The difficult thing is chronic fatigue is hard to diagnose. There's not a tangible diagnosis. Chronic fatigue is very vague. People feel embarrassed because they think there's something wrong with them. I will mention one thing about chronic fatigue that we do know. Exercise and movement helps chronic fatigue.
There's that exercise again. So you know what? Maybe one thing families need to suggest for their elderly are some group exercise programs. So let me switch gears a little bit here. When a family has determined it's time their loved one has progressed and difficult decisions need to be made, what would you say are the red flags that signal that time is here?
I'm going to start with easy red flags. Losing weight, not bathing, wearing the same clothes every day, falling, gait instability where their balance is off, sleeping too much, sitting in the dark, auto accidents, and this is a very important one. Little fender benders are an indicator something's wrong. Another easy one, getting lost. This is an interesting one. If you live in Chicago and your mother lives in Dallas, when you're talking on the phone, forgetting names and forgetting nouns. For instance, does your mother say, I really like that red fruit, as opposed to saying, I really like apples? Because when people have a little bit of memory loss and they start to decline, they start using vague terms and nouns. Some other easy ones, not taking their medications and not filling their medications. And then one that we see about once a month in this office is somebody didn't pay their bill. They get a phone call from the electricity company or the gas company that things are going to get cut off. And we know, okay, they're not paying attention. They're not as sharp as they were. Some harder ones are when people get paranoid or they start questioning everybody about, why are you asking me questions? And one that's concerning right now today is making bad decisions, giving away money, giving away valuables. And I think it's very important to note for this audience, there are predators, unfortunately, looking for older people and their bank accounts. This is a really important reason to keep an eye on the ones you love and a close eye on the people that you care about.
Great point. I didn't even think about that. And I bet we hear that more frequently than people think. Dr. Casey, you have the family meeting, you talk to your loved one. It's only natural. They often push back. They don't see the issue. What do you do then?
I think above all, you should express safety is the issue. And also note that carrots are usually better than sticks. When addressing this person, try to do it without judgment because you want to minimize their defensive posturing. This sounds obvious, all of this, but it's really easy to yell at your 95-year-old mother when she drives to Brahms for ice cream late at night and tells you about it the next day. I always try to use the phrase and encourage families to use the phrase, Mom, this is what I'm observing. For instance, Mom, I saw you fall. Dad, I saw a scrape on the car. Oh, friend, I noticed that your medication bottles are always full. I noticed your clothes look large because you're losing weight. Or, and this is an embarrassing one, but I noticed you didn't make it to the bathroom on time. Then you can ask, how can I help you? Because I know you want to maintain some form of independence. I know that you want safety. How can we do this together? And I want to mention two big things that I notice in my office. Driving. For many people, driving equals independence. How do we deal with people that are driving when we know that they're losing their vision, their reflexes are not as good as they get older, our city's changing and growing rapidly, it's easy to get lost? An easy solution that we do in my office, and people get mad at me, is I say, can you go to DPS and get a driving test? And by the way, one person did and came back and they did a really good job. but it's a way to say there's a check and balance, go to DPS, get a driving test. Also, can I offer to take you to the grocery store? Can your family take you to your religious ceremony? Can they take you to the library? A second thing I notice in my office is self-care. We realize a lot of people don't take their medications because the hassle of opening up the jar, looking at them, figuring out which medication. If you're on 5, 10 medications, it's hard for people to even put their own medications in their organizer. So in this situation, we say, can we have a family member or a paid caregiver come in like once or twice a week, arrange our medication organizer, walk through the house, make sure there's food, make sure there's not a water leak or any other crisis going on, and just be part of our team.
Dr. Casey, that's a great suggestion. Whether it's a family member or some other caregiver, it's great that they would come in and check on things and maybe even check on the loved one for medical conditions like a low-grade fever or some kind of infection that could also be causing problems.
100% yes. We know that low-grade chronic infections in many people, but mostly elderly, can cause confusion. It can cause fatigue. People can seem like they're disinterested when they're just fatigued. For instance, we see all the time bladder infections, urinary tract infections can make people seem depressed when they're really not. They're just fighting something. They don't even realize it. And older people do not always mount a big fever or response. So you may not know that they're sick. Even if they're in a nursing home getting vitals taken every day, they may have something low grade going on that we can immediately find in the office and correct. Yes.
Dr. Casey, what a great discussion. This has been so helpful. As we wrap this segment up, we've been talking about the patients, but what about the children, the grown children, and how they have to deal with this situation?
We do this as an office policy. If you are over 65 or if you're 25 and you have a major medical health issue, we talk to you immediately before you leave about medical power of attorney. Medical power of attorney is a person who can make your decisions for you if you are incapacitated in any way. And we ask the patient, can you discuss with us what you want for your medical power of attorney? And have you thought about a living will? And then can you discuss these plans with your family and this person? And the state of Texas has a great website for finding all this paperwork. Attorneys are not needed. We remind people the best way to make decisions is in advance when you are in charge, not when you're in an ambulance or in the ICU. And people can be super healthy, 95 years old, and walk in the parking lot at North Park, because this has happened to us, and fall and hit their head and end up in the ICU. I mean, things happen. So we encourage this to be done in advance, but also to bring the family in so that we're all in this together so we know we're thinking about it in advance, we're preparing in advance, and then nobody's blindsided.
These are such great tips, especially for those who are walking down that path of dealing with their older family members. Dr. Donna Casey, internist at Texas Health Presbyterian Hospital in Dallas, thank you. We're continuing our Independence Holiday show. When we come back, would you like a job in healthcare? Many of our hospitals are hiring right now. Find out from where when we come back.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back to the show. We're going to discuss workforce now. Workforce is an integral part of healthcare, and we're delighted that we've got with us the Chief Executive Officer of AMN Healthcare, Susan Salka. And AMN Healthcare has provided workforce for many of our hospitals in North Texas over a number of years. Susan, what are your predictions as we look to the future on workforce and workforce issues?
Well, they're not just my predictions, is what you see if you read any research report regarding the workforce in healthcare, particularly I would say the clinical workforce, and that is that the shortages we're experiencing now, which have been exacerbated and accelerated by the pandemic, these shortages are going to worsen. They're not going to get better. And I'm often asked about, well, won't we just see all these clinicians come back into the workforce, those that have taken other careers or have retired or have gone part-time? And the collective wisdom within healthcare is no, they're not going to be coming back, or at least not the majority of them. The pandemic has created a heightened level of burnout that was already within the workplace, but has just been taken to a new level. And many of the clinicians who've departed don't want to come back into that same environment. So it's very important that we help support our current clinicians that are working and have resiliency programs that help to reduce their stress, reduce their workload, and help keep them in the workforce and not burn them out so that they want to depart. Second is to try to find creative ways to help them balance the needs of their professional and personal life. And that might mean going part-time. It might mean more flexibility. The younger workforce today wants more flexibility in their career. They don't want to do what I did and join a company and stay for 32 years. They want to move around, whether it be for advancement or just for life experiences. So we're working with many clients to try to find ways to create flexible programs so that clinicians can move around from facility to facility, either within a region or maybe across the country, and then come back to their hometown or where they want to settle in more permanently. And then we need to find ways to increase the education programs. There's plenty of people wanting to go into medicine and nursing in particular. We turn away as a country about 80,000 qualified candidates from nursing schools. It's very difficult to get into a nursing school today. And the problem is in the bottleneck of the number of slots available in schools. There's a shortage of faculty. If you are a nurse with a PhD or master's degree, you may want to teach, but you also may want to work in a corporation or a healthcare system where, by the way, you're going to make more money than you will as an educator. So we have to do things to increase the number of faculty, and that's partially money, but it's also helping to accelerate the training of nurses with higher level degrees. And then funding helps, particularly in the physician profession. There aren't enough residency programs. You may or may not know that the physicians that are medical students, I should say, that are coming out of medical school don't always get matched to a residency program because there aren't enough residency programs in the country. Why not? Because there is not enough funding. So we're going to be short north of 130,000 physicians in just the next decade. Immigration could help. It's not going to solve the problem, but it would be helpful if clinicians, particularly nurses, could come into the U.S. more quickly. You may know that nurses have to come over on green cards, and that takes 4 or 5 years. I don't know why they have to wait 4 or 5 years when we can get a software programmer over on a short-term visa in less than a year. So there are things that could be done at a national level to bring in highly skilled international clinicians that could help alleviate some of the shortage, but also help them to achieve their personal and professional goals by having greater opportunity for them and their families. AMN does have an international nursing division where we recruit nurses to come over on permanent or temporary assignments. And we have more demand than we can possibly ever fill. Hospitals love these nurses because they come and they stay in the communities in which we place them. So those are just some examples of the things that we can do as a country to try to alleviate these worsening shortages.
You know, those are excellent points, and I think you really touched on almost all that many of the hospitals are talking about today. Susan, I'm going to shift a little bit. Diversity, equity, and inclusion is very prominent today, and it is especially important in hospital workforces. Can you elaborate on some of the things you've done regarding ingraining this in your overall culture?
Well, thank you for that recognition of our team. And for us, it's just honestly a part of our values and who we are. So we were leaders in diversity, equity, inclusion before it was the thing to do, I would say. Now it's good that there's more focus and more organizations are increasing their focus and their impact. But at AMN, it's just really been a part of the fabric of our culture and how we think, and in the inclusive way that we accept people for who they are and actually celebrate that, because it makes us such a more diverse and stronger organization, and certainly far more interesting. So, you know, some of the things that we're known for, I think that you call out, are the strong gender representation throughout the organization, but particularly in leadership positions where I think a lot of companies struggle. So how do we achieve that? Again, I would say it's largely organic in nature, but we also make sure that we are looking at our diversity numbers and asking questions. We don't have quotas within AMN, but when you see the numbers and they're lopsided, it's pretty obvious that you need to move the needle. We have strong representation of people of color across the organization. A little over a third of our corporate workforce identifies as people of color, but we're not quite there yet in leadership. We're in kind of the mid to upper 20%, and we know that we've got room to grow. So how do you get there, and how do you make sure you don't fall backwards if you are in a good place? So one of the things that we put in place is we've gotten larger, is we've needed to put in some programs and processes, and one of them is making sure that we have a diverse slate of candidates whenever we're interviewing, particularly for a leadership position. Now, often you have a great internal candidate and you want to give them the opportunity to step up, but we also want to make sure that we're looking at diversity within and outside the organization and at least interviewing a diverse slate of candidates. You always want the best person for the job, but if you don't have a diverse slate to start with, then you're likely not going to be hiring diverse candidates. And so we take the time to recruit a diverse slate of candidates and make sure that our leaders who are making those hiring decisions are interviewing amongst that diversity. Another example is we make sure that we put our hiring, our promotions, our raises through a filter of diversity to make sure we don't have any unintended consequences. You know, if you are looking back and you see that perhaps all of your promotions were of a particular population or demographic, that might be problematic. There could be some unconscious bias. And so making sure that we're evaluating sometimes before and sometimes after, evaluating the diversity of the decisions that we're making and that we don't have any unintended consequences. And then sometimes I think it just starts with making it a priority. So when I have quarterly business reviews with our leaders where we review what's happening across their different businesses, whether it be one of our staffing businesses or one of our technology businesses. This is a comprehensive review of how the business is performing, financials, problems they might have, opportunities, the road ahead, et cetera. We start that conversation every quarter with a review of their diversity and workforce trends. What does diversity look like within their business? What does turnover look like within their business? And if there are issues, why? Diving into the people-related issues before you even get to the numbers, I think is an important statement to make to your colleagues.
Many hospital CEOs listen to this show, and I know there's a question they would love me to ask, because when we look at agency nurses and we look at the billing rates, they've been really high, especially during the pandemic. And Susan believes the rates have peaked as of the beginning of this year.
In really the first quarter was that peak point for demand for wages and, therefore bill rates. And we've been predicting for quite some time that the order levels would decline, the wage needs would decline, and therefore the pricing would decline. And that's exactly what's happening. Bill rates have come down from the first to the second quarter. We believe they'll continue to come down considerably in the remainder of the year. And we've been so bold as to even put out a prediction of how much we think rates will come down, and we're kind of thinking it could be roughly 35% from the peak in the first quarter till where we exit the end of the year.
Susan, thanks so much for being with us today. And for those of you that may not know it, Susan has announced her retirement. What a wonderful career. And we wish her the very best in the next chapter of her life. Please stay with us. On our next segment, we're going to be talking about children's dental health. And we're going to be talking with Dr. Tonya Fuqua about tooth decay and how it can affect our kids' overall health.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We are going to have a wonderful conversation now with Dr. Tonya Fuqua. She works with Cook Children's in Fort Worth in a nonprofit dental program called Save a Smile, helping low-income children in our community. Her practice is Fuqua Advanced Dental in South Lake, but she is just a tremendous resource of information. Dr. Fuqua, I'd like to ask you, as far as kids and adults, really, for that matter, when we think about things that we eat and how it affects our teeth, what happens with sugar and carbs versus vegetables and fruit versus meats as far as how they each impact our teeth?
Well, that's a really great question, Thomas. People don't always, they first of all think about food and think of body, how it affects your body. Well, your teeth are part of your body, and everything we eat and drink does impact our body and our teeth. So one of the biggest things that we see that children are doing, and I think everybody thinks, okay, well, that's just obvious, sugar. It's not just candy. It's not just candy. People think, well, that's the problem, but candy, cookies, cupcakes, you think about all the sugar, but people forget about all that liquid sugar. Juices, natural apple juice. People think, well, that's apples. That's a fruit. That equals something healthy. But apple juice and 100% sugar, or any fruit that has natural sugar in it, too much of it, that's natural sugar. So even like a diabetic has to be very careful with how many fruits they're eating and which kinds, because it can impact their sugar levels. And that's the same with teeth. Pure 100% apple juice or juices have a lot of sugar content. Gatorades, Powerades, our sports drinks, the Monsters, the energy drinks, coffee. Children are now drinking, love the Starbucks and the coffee drinks, and all of those have a lot of sugar in them. We could see kids that their whole life, I've seen them their whole life, and they've never had a cavity. They go off to college, and all of a sudden their diet changes completely. They're eating and drinking things that maybe mom or dad didn't let them do at home, or they didn't have access. Now they're needing energy drinks and they're needing caffeine, and they're drinking those things, and they're staying up later and then falling asleep and not brushing or cleaning. So when you talk about, and then you mentioned carbohydrates. Carbohydrates break down to sugar. So we all love bread, and we don't maybe think, well, we think bread is maybe not that healthy, but it breaks down to sugar. Carbohydrates, crackers, and our goldfish that we give our kids, and pretzels, those things break down to sugars. And like I already mentioned, fruits and vegetables, always best selection. As far as putting in a good balance in our diet, fruits and vegetables are great for our teeth as well as our body. But getting protein and also getting that, like the milk and the calcium, that's also great for the building of the teeth, and the protein for the strength and the health. Protein even too for the gum tissues. So it's not just teeth, but there's gum tissues and bone that support those teeth that are in your mouth, and the different good balanced meal that we always ask for our body. Same thing to impact the health and the strength of our teeth and our enamel.
That's great.
Bone.
Great answer. Something that I came about, we're talking about kids here as well. When I was a teenager or maybe into my 20s, the dentist said that I'd been over brushing and has been eroding my gums. Can you tell us about that?
Yes. Wow. That is something that we see all the time. And it's really, you can call it overbrushing, or it's more appropriately known as you're not brushing correctly, right? So there is a right and wrong way to brush. And that's part of the big importance of going to a dentist early and starting the good habits and learning how to do things correctly. So brushing should be done in a circular motion. You should always be using a soft, bristled toothbrush with an appropriate size head. Everybody thinks that the bigger the head, the more surface area they're getting, but it needs to be appropriate for everybody's mouth, because everyone's mouth size and teeth size are different. So some people may require a much smaller head so that it can get everywhere in the mouth. So appropriate size toothbrush, soft bristles, and circular motion at a 45-degree angle, meaning you don't want to scrub back and forth and you don't want to go up and down. Those motions over and over and over cause us to get what is known as receding gum line, meaning you literally brush the gums away. And our body is remarkable about healing itself, but that is one thing that it will not recreate. It will not produce new gum tissue that you've brushed away over time and over time. So brushing correctly will really prevent from damage to the gum tissues and then to the tooth, because then the root's exposed. And the root is not meant to be shown to the real world. It's supposed to be covered up with gum tissues. Yes. So it can become very sensitive to have the root exposed.
Boy, y'all don't take a sip of anything cold right now. You'll feel it in your mouth. Okay, I want to clarify a myth here, because I've heard that plaque in our mouth can be connected to plaque in our arteries that could lead to heart disease. That seems hard to believe, but are those two really connected?
They are connected. There is a direct link, and there are many, many studies that have the direct link between the type of bacteria and the bacteria that we grow in our mouth and that we let overgrow in our mouth is linked to heart disease.
We mentioned at the onset the program that you're involved with in Fort Worth, the Cook Children's Save a Smile program. Can you tell us more about that?
Oh, I would love to. Thanks for asking about Save a Smile. This program was started in 2003 when Cook Children's just really said we need to get on board and do something about oral health, because too many children were ending up in the emergency department, coming to emergency room because of dental pain or swollen faces because of dental pain, and or requiring little 2- and 3-year-olds requiring dental surgery in an operating room setting because they had so much decay. So Save a Smile was created in 2003 to prevent that, kind of a grassroots, innovative type program where we go into the school system and actually provide dental screenings free of charge by a licensed dental provider, a dentist in our community that volunteers their time to screen these children and identify these children that have severe level of dental disease. And then we have a social service component that connects those children to private practicing dentists in the community that provide free dental care. We're going into Title I schools. So these are kids that are, 80 to 90 or 100% of the kids are qualified or on free and reduced lunches. They're at risk already with all kinds of things. And dental becomes very low on the priority list. So with our social service component, with our master's level clinical social worker that supervises community health workers, we go in and find these children who need us and then connect them to a dental provider to provide comprehensive care, meaning anything and everything they need, from fillings to all the prevention, teeth cleaning and x-rays, maybe stainless steel crowns, and gosh forbid, but it happens all the time, extractions. Anything that child needs to get them healthy and happy and smiling again and keeping them in school. So that is a huge priority. We're blessed to have been doing this now for 19 years. And it's a huge collaborative effort within our community, with our school districts, our dentists in our community, and Cook Children saying this is important and this is vital to the health of our children in our community.
Such great advice for young and old from Dr. Tonya Fuqua. Her practice is Fuqua Advanced Dental in Southlake. Steve?
Thank you for joining us today on the Human Side of Healthcare. We hope you enjoy your 4th of July. Be safe. And remember, Omicron is out there. The numbers are up. One of the things that we've seen that's the most effective over the past 2 years is wearing a mask, especially in those large holiday crowds. Join us next Sunday on the Human Side of Healthcare.